The diet helps, being on a liquid diet, but diabetes, I've lowered my insulin and my blood sugars have not raised over 200 in the last 5 days ever since surgery. I've had digestive issues for over a year and it has eliminated that. I am now regular. I have no stomach aches. Even though I have gastroparesis, I have not had any issues after this surgery. Has made a lot of the symptoms I've had better. So
So tell me, what did you come here for? Like, we met on Friday, right? Yeah.
yes, we met on Friday. I came here because I went through a same situation where I had pain in the left side of my jaw. It was being diagnosed by a regular dentist and was missed, and a periodontist removed it, extracted it, but never took care of the core issue, which was the periodontal disease across the entire mouth. And that's why I came here, based on my research.
So tell me, in addition, we talked about your medical conditions, right? Like how the medical conditions, can be affecting your gum disease, or how the gum disease could be affecting your medical conditions. So
Yes.
tell me the medical conditions you had.
Uh,
You have.
I have periodontal disease, or I have gastroparesis, a digestive thing caused by my diabetes. A lot of this is all caused by my diabetes, but diabetes being one of them. I was a fragile diabetic, meaning my blood sugars tend to run high, but I was on a higher dose of insulin on a very good diet, but yet it still would run high periodically. Those were the common things that I've had for basically the last 2.5 years, which was a year and a half ago. I had the right side removed because of the bone loss on that molar. And the reason I came in for this one, same issue.
Okay. So tell me, like, how does it make you feel now? Like, you mentioned about your body overall generally feeling better. Like, you don't have to take as much of a diabetic medication. Your gastrointestinal problems have gotten better. So
Yes.
can you tell me about that?
Yeah. So a big part of that was for my own research. And again, I'm not a doctor, but the bacteria that sits there, and one of the key things here was I was constantly having signs of infection in my white blood count that my doctor could never diagnose. Sometimes I thought it was due to some skin issues. I would be put on a low dose of antibiotics. I would be fine, then would peak again. And this has been a battle that I've had for a year now. But knowing that bacteria can build and get into the bloodstream, I mean, it's basically in your mouth, it's directly into the bloodstream. So it makes sense why I was having all these infections, and with infections raises blood sugars because it's trying to fight that. Now, if that's been removed, then that means the blood sugars don't have to, or the diabetes does not try to fight the infection, but it keeps the blood sugars normal. Hopefully
I
that
know,
makes sense.
I know, buddy. Like, we talked about your profession, how it relates to what you do, to how the way I explained it to you, right? So
Yes.
tell me, like, how would you explain, like, in a like the way that related to your profession that we talked about?
That's a little tricky. I mean, basically, so in my profession, we tell our customers that just patching or mitigating an attack,
A cyber
does,
attack,
a
right? Yeah.
cyber attack does not stop how the attack happened or the attacker got in. So once you isolate the attacker and evict the attacker, you need to go back and also make sure that you are closing the windows and locking the doors, which is a lot of times what doesn't happen with people. And medical and diabetes and dental all applies in that same aspect. So it's a really good analogy.
You got it, buddy. Thank you so much. Okay,
Thank you.
thank you for spreading the world, spreading the message to the world. I think a lot of people are going to benefit from what you have said. And guess what? Like, people all over the world are watching you here, so you're helping the world.
Well, you're gonna have a next patient. My wife is a rheumatoid arthritis as of 18 years old, and she has been seeing the same doctor and has concerns that she has mild periodontal disease, and she thinks some of that bacteria may be causing a lot of her other medical issues that are being treated, but not treated because the core is coming from there. So she will be the next patient that you have in my family that you will see. Hopefully
Thank,
help her.
thank you, buddy.
Thank
Appreciate
you.
it, man. Okay.
Appreciate
Take
it.
care. Okay. Thank
Thank
you.
you.
Yeah.